Hello, everyone. I'm Stella Roque, Director of Community Engagement at the International Center for Journalists in Washington, D.C. We're so glad to have you here today to talk about the public health response to the COVID-19 pandemic. Joining us today all the way from Germany is Dr. Claire Standley, an assistant research professor at the Georgetown University Center for Global Health Science and Security. Her research focuses on the analysis of health system strengthening and international capacity building for public health, with an emphasis on prevention and control of infectious diseases in both humans and animals, as well as public health emergency preparedness and response. Welcome, Claire. We're so glad to have you.
Thank you so much for having me.
Thank you. So to start off our discussion, we've been hearing a lot of bad news about the consequences of this pandemic, especially in Italy and Spain, and the US's infection numbers have now surpassed China's. And yet some good news about countries that seem to have successfully curbed the spread of the virus and limited its impact, such as reports from China, South Korea, and even Germany, where you're based. Let's start with a broad global question to open this conversation up. In your opinion, who was prepared for this pandemic? Who wasn't? And which countries are doing the best job of responding and why?
It's a great question. I think, perhaps the simple answer is that no one was specifically prepared for this outbreak, for this pandemic. Scientists and public health experts have been predicting that a pandemic like this could emerge. We've been talking about it for some time and urging countries to prepare, but the specifics were always going to be an unknown. Even a couple of years ago, the World Health Organization added disease X to its list of top global health priorities in anticipation that we may not know where the next threat is coming from. And so we need to be prepared even for those emerging infectious diseases for which we don't have existing data or existing characterization. That being said, obviously there are some countries that have responded more quickly, and I think there are some indicators that we can point to show better preparedness. And a lot of that, I think, comes from experience of past outbreaks. We do learn, hopefully, from our mistakes in the past. And so just a couple of examples I'll give. One is that obviously countries that were affected by the SARS crisis in 2003 seem to have been quite ready when it came to deploying rapid testing and case management, particularly isolating infected people and aggressively monitoring their contacts to try and limit initial transmission. And so we've seen that particularly in a number of countries in East Asia, Hong Kong, Taiwan, also Singapore to some extent. And then I think another lesson is how countries have adjusted their regulatory structures to anticipate these types of crises. So one example is South Korea, which has been widely praised for its very aggressive testing strategy, testing tens and hundreds of thousands of people to really identify transmission as broadly as possible. And that actually came about due to the 2015 outbreak of MERS in South Korea, which was largely spread through various hospital sites. And at the time, South Korea's regulatory structure didn't allow for the rapid development and deployment of tests without a lengthy regulatory review and approval process. After the 2015 MERS outbreak, that changed to provide a much more streamlined regulatory and approval process, and that's the reason that South Korea was able to deploy its tests so quickly. We saw exactly this problem happen in the US during this current coronavirus outbreak, where the FDA only approved a specific CDC test, and that led to real delays in the rollout of testing. So I think other countries hopefully will learn from this experience in the same way that South Korea did in 2015.
So you mentioned a lot of these countries that had already had previous experience with outbreaks. Now what's interesting is I've been kind of watching the differences between the way the global north has been responding to this versus the global south, where we have developed countries being especially hard hit. And in Africa in particularly, we're still seeing data incoming about cases in Africa, but do you think that a lot of the experience in the developing world, especially with facing previous types of epidemics, are going to be really helpful in having their governments and communities respond to this?
I certainly hope so. I mean, I think that there's been a lot of investment and a lot of interest in building public health capacities for preparedness and response to infectious disease outbreaks over the last, say, 10, 15, almost 20 years, particularly since SARS, and particularly since the entry of force into the new international health regulations, which is a WHO mandated set of regulations binding on all countries to develop core capacities to assess, detect, report, and respond to potential public health emergencies of international concern. So in an effort to implement the IHR, as we call them, many countries have been building up those capacities for early detection early notification and rapid response to potential pandemics and other types of disease outbreaks. For example, I think we are seeing, I think the 2014 West Africa Ebola outbreak was also another wake-up call for a lot of countries to realize that their systems were not sufficiently strong to have that rapid surveillance, rapid detection, rapid notification, rapid response. And as a result, we've seen a lot of investment and a lot of capacity strengthening being provided, particularly in countries in sub-Saharan Africa. And so far, I think the signs are quite promising, at least in some countries, in terms of the efforts that have been made to do contact tracing and monitoring of those cases that are identified, and particularly with laboratory capacity. And here I have to give a huge credit to the Africa Centers for Disease Control, the Africa CDC, which was set up in 2017 and has been hugely instrumental in providing support for training and capacity strengthening to allow for countries to do the diagnostic testing for COVID-19. I think there's 43 or 44 laboratories now across the continent that can do the testing.
One of our reporters posted a really interesting article in our forum last night on a publication called The Conversation. And the title of that article is "There is no one-size-fits-all response to COVID-19." And it critiques the fact that although the WHO has these technical guidelines that are supposed to be kind of applied on a widespread level, they might not necessarily fit all the social contexts, like for example, in Africa versus Asia, especially with issues of social distancing, limiting movement, where there could be actually a very negative economic repercussions. Something, I think recent news of this morning, we noticed that South Africa is putting everyone on lockdown for, I think, 21 days, 3 weeks. And some of the local people that they were interviewing said, like, I can't be on lockdown for 21 days, I'll starve. Like, there's not going to be, I have no ability to put food on the table. Do you think at the end of the day, each of these governments need to tailor their responses based on their social context? And what do you recommend that they do?
It's an excellent question and a very, very challenging one for sure. Look, WHO's role as the public health arm of the United Nations is to provide global guidance. They're there to provide norm standards and technical support across their member states in the face of individual health events, but also crises like this one. That said, countries are provided latitude, of course, to implement those guidelines and those suggestions in their own ways. And of course, I think we're seeing that this pandemic in general is one of the largest economic shocks globally that we've ever seen. It's completely unprecedented in terms of its scale and scope and in terms of what it's doing across both the lower income countries as well as higher income countries. This is, I think we've seen very clearly that rich countries are not immune from this either. That being said, of course, we do have to be particularly concerned about the most vulnerable people who are largely in lower and middle income countries who may really face challenging times, particularly without some of the safety nets that may be in place to help support them in this time of crisis. Governments face a very difficult decision, and again, this applies globally. To what extent is public health your first and foremost goal? Obviously, I'm a public health expert, and I think that that's something that's very important to think about. But we, of course, have to take into account social and economic considerations too, and particularly the impact on people's lives and livelihoods. In that, I completely agree with you. I think responses have to be tailored to the local context while bearing in mind what we know about the transmission dynamics and the methods that seem to be effective in controlling this virus, which does include non-pharmaceutical interventions like social distancing, which may be very challenging to implement in some settings, but are, unfortunately, it seems quite important in controlling its spread. That is going to be particularly true in countries that have limited numbers of hospital beds or limited numbers of acute care facilities for people who will get sick. And so in those settings, you really do want to be limiting the number of cases as much as possible.
So one of the important things when it comes to tracking this virus is testing. And we've been reading a lot about testing in the news. The Johns Hopkins Coronavirus Resource Center, has been an amazing source of information and data about, the cases of coronaviruses, who has recovered, who has died from them. On the one hand, at first glance, it appears we have a lot of data on this pandemic, but on the other hand, there are countries where it seems that there's a minimal number of cases. And I'm wondering if, in your opinion, that could be because of the result of the lack of availability of testing or government transparency in reporting. Could there be many more cases than we know about in these countries? And in your opinion, as a researcher, what could journalists do to help fill that data gap?
Those are great questions. So trying to tackle them all at a time, and please remind me if I've missed anyone at the end. In terms of the transparency element, I think there's definitely a role for journalism to help support transparency in a responsible way. Governments are going to be the primary source of information on confirmed cases, since laboratory testing is primarily done in either government or government approved or accredited facilities. And so there is that very important formal notification process from the country to the World Health Organization and shared that way. That being said, I think particularly in countries where there may not be such a great record of that level of transparency or concerns about whether transparency is happening, I think journalism can play a really important role. That being said, we have to be so careful not to spread rumors or misinformation, which may severely hamper the response or cause people to panic or cause people to behave in ways that actually could exacerbate transmission. So I think there's a balance to be had there. In terms of the cases, of course, that's everyone's concern that there are undetected cases out there, and that countries aren't testing either appropriately or enough or don't have the capacity to do so. As I said, again, particularly in the African context, which is probably the region where I'm most familiar in terms of the testing approach, Africa CDC has been phenomenal in ensuring that countries are able either to test in-country or in a country within the region where they send their samples. And so that, I think, has greatly enhanced the ability to diagnose cases early. Whether transmission is ongoing in other places, look, there's also a lot of countries around the world that have been affected by, say, conflict or other humanitarian crises, and where those capacities have been stretched even before the COVID-19 crisis. I think those countries are going to really need support from the international community and perhaps from their regional partners as well in ensuring the cases are being detected and surveillance is really robust. Yeah, I'll stop there. And then, did I answer your question fully?
Yeah, absolutely. Well, another question I had that could be of use to these reporters, is there a source of information that we can get, like for each of these journalists in their own country, where they could find out what is the number of tests that each of their governments have?
So my understanding is that information is not being reported consistently across different countries, and so it does vary from place to place. The Ministry of Health website is probably the main resource to look to in terms of who's been providing that information. Some countries are being much more transparent, both in terms of things like testing, but also in terms of reporting on cases. And I think the spectrum goes all the way from reporting a minimal amount of information in some places, which I think is challenging, to those who are going so far as to release patient names, which also obviously poses its own challenges in terms of privacy and respect for individual rights. So we're certainly seeing a very large spectrum of behavior from the parts of governments in terms of what data are being shared and how.
I see. And based on your expert view of the media coverage of the different public health responses to this pandemic, what stories do you feel have been underreported in this area, or angles of stories that haven't been done yet? Where should journalists be prodding more to keep their governments accountable and the public informed, no matter where in the world they are?
Yeah, I think testing is definitely a good one. I would love for governments to be held to some sort of unified standard in terms of publishing information on numbers of tests or testing capability, numbers of people that are coming forward to be tested, and sort of that approach to identifying new cases in the community. Obviously, coming back to Africa, particularly in sub-Saharan Africa, the vast majority of cases are still being imported. There are a few exceptions. For example, South Africa is obviously experiencing a different scale of transmission than some of the other countries. And so I think one thing that would be really interesting to look at is the impact of the travel bans and the other social restrictions that are being put in place very rapidly by governments all over sub-Saharan Africa in response to trying to stop some of these imported cases. And what impact that may be having on the economy, on the social structures, on other aspects of the country, because we haven't really seen those types of border closures in other places, particularly in other places that haven't had lots of cases yet. And so are publics in those countries feeling that this is overly aggressive? Is this too invasive on their daily lives? Or are people recognizing these as necessary measures to stop the spread of something that could be potentially completely devastating to their communities?
Thank you. So we're going to open up to questions from our reporters, some of which I do have here. Let's see, I can't pronounce this reporter's name, from Pillar. What is this pandemic teaching us about individual countries' health systems? And how could this affect the adoption of the SDG number 3 of health and well-being for all? I think that's a sustainable development goal.
Yes, yeah. I'm sorry, can you just repeat the first part? I lost you for a second there.
Sure. What is this pandemic teaching us about individual countries' health systems? And how could this affect the adoption of the Sustainable Development Goal number 3 of health and well-being for all?
That's an excellent question, Flora. Thank you for asking that. So I think one of the things that has shown us is that, as we talked about at the beginning of this, is that no country has been immune from rapid transmission and from having their health systems completely stretched by this pandemic. And so I think it's really left us rethinking what we need by having a well-prepared and well-structured health system for a pandemic preparedness and response standpoint. In terms of SDG 3, I think one of the things that I've been noticing at least is creating that link between public health and healthcare. There's obviously a lot of structures that have been put in place, as I mentioned before, as a result of the international health regulations, as a result of experience with past outbreaks, related to building surveillance, laboratory, workforce, and emergency preparedness response capabilities across countries. But as far as I'm aware, and again, I come from the public health side, there's been much less effort to link that to healthcare facilities, to hospital beds, to understanding the needs within the healthcare system. On a very fundamental level also, I think a key element of this is understanding how critical the right to healthcare and health for all is as a fundamental principle to pandemic response. We need to be assured that people are going to be able to get the healthcare that they need in order to survive this kind of crisis. And I think countries that have been struggling to implement universal health coverage are some of those that may be most threatened by large numbers of cases because they may not have the infrastructure or the financial protection for people to be able to receive the care they need.
One of our reporters from Macedonia submitted this question last night, which I think probably applies to much more countries than just Macedonia. She noted that healthcare institutions in her country have been struggling to offer enough tests for the novel coronavirus. Mm-hmm. And she pointed out that private health clinics and private companies are profiting off the crisis by selling what they claim are rapid test kits. And she asks whether that's ethical, and I'll add, what should governments do about bad actors seeking to profit from the pandemic? Essentially, these are pandemic profiteers.
Yeah, absolutely. Look, I think that, first of all, there is no rapid diagnostic test that's commercially available, to my knowledge, either privately or publicly. And so I think the charlatanism side of it is a whole different issue. Even if there were these types of tests, the profiteering aspect is definitely something of a challenge, and it is happening in many countries outside of just Macedonia. Look, I think that it's obviously, in my opinion, it is unethical to profit in this way from a pandemic. I understand also that some of these companies themselves have been arguing that the price of their own reagents has been going up. And so it's sort of a chain of raised prices that is leading them to pass on some of the cost to the consumer. But regardless of the rationale, I think there are things that governments can do about it in terms of regulating prices. We saw that, for example, I think in Italy, they regulated the price of hand sanitizer and other products. Some countries have requisitioned large supplies of things like PPE, masks, and other equipment to protect frontline health workers to ensure that they aren't being stockpiled by individuals and used for profiteering purposes. Beyond that, I'm not a legal expert, and I think there are people out there who can certainly provide more specific suggestions, but I certainly think that there's a role that government can play in limiting that kind of activity.
This week, the New York Times reported that Indian Prime Minister Narendra Modi ordered all 1.3 billion people in his country to stay inside their home for 3 weeks, similar to the measures South Africa just took this morning. One of our forum reporters from India wanted to know, what impact will this measure have on the spread of the virus, and is it effective?
I mean, look, we know that transmission of the virus happens largely through close contact between individuals. It's transmitted via droplets, so you have to be within quite a close distance with somebody else, usually for the transmission to be effective, to transmission to occur. And so if you are limiting the number of those types of interactions between individuals, then yes, theoretically at least, you will stop the spread of the virus. That being said, obviously in places where you have large households, you may actually exacerbate transmission within your household. That may be particularly worrisome in places where there's a lot of intergenerational households, and so you may be having mixing between younger people who may have mild cases or asymptomatic cases and their older relatives who may be more susceptible to a severe infection. Certainly some of the preliminary data coming from Wuhan in China did show that as the very strict quarantine and lockdown policies came into place, household transmission was elevated as a source of new cases. So that is something to think about. So my opinion would be that once you have these lockdowns in place, looking taking aside the social aspects of ensuring everyone has food and mental health and well-being, which I think are critically important, there also needs to be follow-up approaches to still identify new cases, make sure that they're being treated and managed appropriately, and in that way understanding how transmission is changing over the course of this time frame in your population.
So one of our staff members actually has a question, which we were discussing before this broadcast happened, and I think you had a very good answer that we should share with everyone. Do we know how long this should last for this to be effective in terms of us all staying at home and in containing the general spread of the virus, and for our healthcares to get a hold of the situation?
Mm-hmm. Yeah, it's a really good question, and obviously a very important one, and one that I don't think anyone knows the exact answer to. My sense is that we're going to be under some sort of not restrictions per se, but there's going to be concern about transmission, at least until we have a large proportion of the population immune, and that can happen one of two ways. Either that population gets exposed and recovers, or we have a vaccine. We know that the vaccine is about 12, maybe even 18 months away. Even if we look at 12 as sort of an optimistic timeline, that still means a long time for people to be living under these very stringent conditions. That being said, at least again, theoretically, in a few weeks of a very intense lockdown type environment, you would expect cases to slow down at least. You won't expect them necessarily to go away, particularly due to the household transmissions I mentioned earlier, but you would hope that that would ease some of the pressure on the health system. And so I think it's going to be very interesting to see how governments respond to that. First of all, how well they can detect those reductions in cases, and this is where testing is critically important. And then at that point, recognizing at what point is it possible to maybe very strategically and in a very tailored and careful and risk proportionate way ease some of the restrictions to allow for some aspects of life to resume to quote unquote normal. Recognizing that any type of return to normalcy is going to result in new cases. And so that has to be very carefully managed by governments and public health authorities to ensure that the health system doesn't become overwhelmed again, and we don't see these second or third or fourth waves in a way that would overwhelm the health system. So my sense is that those people who are in higher, more vulnerable risk groups, so those who are over 70 years old, those who have underlying medical conditions, may be facing quite a long period of restrictions and social isolation, for example, maybe 3 or 4 months. The rest of us may see some easing in the coming, say, 1 to 2 months, but I would certainly caution against governments easing them too quickly, because we could see that backlash in new cases again, and it would undo the good work that's already been done by communities everywhere.
You mentioned a bit of knowledge about sort of vaccine development. Would you be able to speak on a question regarding vaccines or not? Let me know.
In very, very general terms, I'd be happy to try.
Okay, so one of the questions we've been getting a lot of from reporters, especially out of Africa, is, people have been mentioning antimalarial drugs as a potential treatment for COVID-19. What is your opinion of that?
Yeah, so I think it's an interesting thing. So chloroquine is particularly the one that's been mentioned. And there has been evidence in vitro, so in the laboratory setting, that chloroquine has some antiviral properties. That being said, its use it has been tested in clinical trials for other viral diseases, and the results have not necessarily been that promising. I know with respect to COVID-19, there are clinical trials underway, particularly chloroquine in combination with an antibiotic as a potential treatment. But until we see the results of these scientific trials, these randomized control trials, we aren't really going to know anything about efficacy, and we certainly don't want people to be self-medicating until we have those data in hand.
Mm-hmm. And one reporter from Ghana asks, is inadequate human resources and limited logistics enough of a reason for a government to call for a lockdown?
So I think there's at least a couple of points there to talk about. So my sense is that most governments are not calling for a lockdown due to limited logistics or limited workforce. They're doing it to prevent spread of the disease. It doesn't matter how well trained your health workforce or how extensive or how good your supply chain is, if there's people out and about, particularly if they have only mild symptoms or are asymptomatic but still transmitting the disease, you are going to get more cases. And a proportion of those cases, and the percentage seems to be, we're not completely sure, but at least 10 to 20% of those cases, depending on the age group, are going to be severe cases, and a proportion of those are going to have to be hospitalized, and a proportion of those are going to die. And so regardless of your workforce, regardless of your supply chain, you need to be limiting transmission through certain other measures in order to keep that strain on the health system down.
All right. I think that wraps up our conversation for today. I just want to say thank you so much for helping us inform reporters around the world on this topic. It's great having you here. And to the reporters watching, please keep the conversation going on our Facebook forum group. And if you don't have Facebook, we encourage you to sign up for our newsletter to keep up with upcoming events. Next week, we will have more webinars upcoming, including a very special panel with Maria Ressa, our 2018 ICFJ Knight Award winner from the Philippines, and the founders and editors of two other online news outlets, the Daily Maverick, South Africa, and the Quint in India. In their session, they will tackle everything from journalist safety to disinformation to press freedom during this pandemic. Thank you again, Claire. I really appreciate your time and you coming here to talk to us about the public health response to this virus.
Thanks, Stella, for having me. And again, if anyone wants to follow up, you're welcome to reach out to me.
Yes, definitely. I'll be sharing Claire's contacts to the group, so you're more than welcome to reach out for her for comment or questions or interviews. Have a good day, Claire, and stay safe.
Thanks, Stella. Likewise, and to all of you as well.